Okay, discharge teaching. For diet, adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For your activities, gradually increase your activities until you're back to your normal routine. Rest frequently, no lifting, pushing, or pulling in the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you are released by your physician. Your breasts and nipples may have changed or grown in size during your pregnancy. Wear a well fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. For patients not breastfeeding, wear a well fitted supportive bra for at least 3 to 4 days following your delivery. Refrain from stimulating the breast and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs or ice packs for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to bare skin. Do not massage or apply heat to the breasts. Breastfeeding tips: your baby's mouth should form a tight seal. The lips should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. You should nurse as long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It is important for the health of your breast to have your infant feed from both breasts every feeding. Good signs of nursing include having your baby swallow without a clicking sound, seeing movement above the baby's ears, and they may even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned correctly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Hygiene. Wash your hands frequently as you're caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It's important you change your pad frequently. For bleeding, vaginal flow will decrease in amount from bright red to pinkish to brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after your baby is born. For bowel movements, you want to avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. Birth control. Discuss birth control options with your healthcare provider. You may choose to obtain a method or of birth control before resuming sexual intercourse. As far as sexual intercourse goes, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Some signs to report to your healthcare provider immediately include pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision, or the incision begins to open. It may include the perineal laceration or open C-section incision. Discharge from the vagina that has a bad odor, severe headache or blurred vision / visual changes. Uh, Temperature over 100.4, or you feel cold, feverish, or have chills. Thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in the legs, breasts are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. Sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control, unable to empty your bladder, or urination that is painful, difficult, or too frequent, or difficulty having a bowel movement. And to report domestic violence or abuse, call 1-800-96-ABUSE. For infant safety, for sleeping, place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parent, but not in the same bed. Avoid covering the infant's head or overheating. For the bulb syringe, keep the bulb syringe near the infant at all times to clear the throat or nose if necessary. Clean the syringe with warm soapy water after each use. Allow it to air dry. Wash hands prior to handling the neonate. For car seat, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. Excuse me. In the home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of sudden infant death syndrome. Behavior: crying is a normal response for your infant. The most likely causes for crying are hunger, need for diaper change, or needing to burp. You should burp your infant after each feed. For calming techniques, you may feed your infant, change the diaper, gently rub the back or tummy, walk with your infant, rocking your infant, skin-to-skin contact, giving your baby a pacifier. It's never okay to shake your infant. If you get frustrated or angry, put your infant in a safe space, take a break, and call a friend. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck and abdomen. For their diet, breastfeeding, your infant should breastfeed 8 to 10 times a day per their cues. Positioning: you should be holding the infant close to you while feeding. It needs to be cuddled, and skin-to-skin time is recommended after feeding. Hold your infant upright over your shoulder while gently patting or rubbing his or her back to burp. Formula feeding: your child is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. For positioning, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. For burping, they need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Newborn rash. It's normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powdered, perfumed soaps. For milia, they are pearly white bumps, usually on the face, especially the nose. They will disappear within the first week of life. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. For bathing, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant soap may be used on your infant's body. Keep the umbilical cord clean and dry. Cleanse with... Hey, get out! Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. 1 to 2 wet diapers are normal for the first day or two of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant will have at least one bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Regarding their genitalia, females should always wipe, if the baby is a female, always wipe from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For uncircumcised males, always wipe from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. For circumcised males, always wipe from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for 24 hours. The head of the penis will appear red initially and then will change to a yellowish sticky film. This is normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider immediately. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. As far as dressing your infant, you should dress them as you would yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. For vaccinations, they should receive all of the recommended vaccinations.